Hi, I'm Dr. Anantharaman, consultant endocrinologist at Magna Centers for Obesity, Diabetes and Endocrinology at BTM, Bangalore. When should we undergo screening for osteoporosis? Osteoporosis is a dangerous disease, right? So if you have osteoporosis, you are at a higher risk of fractures. And why are fractures important? Fractures are important because at old age, when you suffer a fracture, the mortality and the morbidity in the immediate months after that can be very high. For example, if you're a 75-year-old or an 80-year-old elder and you suffer a hip fracture, then that can lead to your demise eventually. Had you avoided that fracture, you would have postponed your death. So this is one of the leading killers of the elderly, actually. Not only elderly, even in slightly older population, but not really very old population. Also, osteoporosis can be a huge morbidity. All right. So, and when do we start screening for osteoporosis? Obviously in old age. All right. So because osteoporosis causes its maximum impact due to fractures, and fractures tend to happen in older individuals. So typically the recommendation is to screen women for osteoporosis after the age of 65. This is a universal screening. It means that every woman that is living past her 65th birthday must have her bone mineral density tested and see whether she has got osteoporosis. Is there a role for doing it earlier? Yes, there is. We tend to offer earlier screening in those women who have undergone, who have had a menopause earlier, say in the sense that usually menopause happens at 50. So instead of 50, you have menopause at 40 due to some reasons, or in fact earlier because of some rare conditions. It's better to screen earlier for osteoporosis because exposure to lack of estrogen is number one reason for osteoporosis in women. So if you have onset of estrogen deficiency earlier, you screen earlier. That's one thing. And also if you have a very strange family history wherein you get all the family members getting a fracture very early on in life, because bone mineral density and osteoporosis are actually determined 50% of it is by genes. So if you have a family which in general has weak bones, you're justified in going for a screening earlier. But typically the screening starts say around 50 years of age, even in these individuals. In rare cases, where in conditions where there is likely to be severe osteoporosis, where you have had to give steroids for a long duration, you can screen for osteoporosis in younger individuals. But typically screening very young individuals, say 25, 26 years of age or even 30 years of age, without any risk factors for osteoporosis, without any fractures, screening them for osteoporosis is probably not very useful.